Azithromycin, an antibiotic drug in the family of macrolide drugs. Azithromycin treats a variety of infections, including infections of the ears, throat, lungs, sinuses, skin, and gastrointestinal and genitourinary tracts. It works by inhibiting the growth of bacteria. Azithromycin is available in tablet, liquid suspension, and injectable form. Azithromycin is on the WHO list of essential medicines. You can find azithromycin sold under various brand names across the world, like Abactin, Astro, Avzeth, Cetaxim, Hemamycin, Ultrion, and Zeto. Azithromycin may cause side effects such as diarrhea, nausea, and abdominal pain. Azithromycin can interact with other medications, such as antacids and certain anticoagulants, potentially reducing its effectiveness or increasing the risk of side effects. Atorvastatin, marketed as Lipitor, is a statin medication. It is used to decrease the amount of bad cholesterol, fats, and increases levels of good cholesterol in the blood. The body produces by interfering with an enzyme in the liver needed to produce cholesterol. Atorvastatin isn't recommended for children under 10. Atorvastatin may cause side effects such as muscle pain, diarrhea, and liver problems. Precautions involve keeping an eye on liver health and avoiding excessive alcohol intake. Atorvastatin can interact with other medications, such as certain antibiotics and antifungal drugs, potentially increasing the risk of muscle toxicity or liver damage. Atomoxetine, sold under the brand name Strattera, is a medication used to treat attention deficit hyperactivity disorder, ADHD, by increasing the levels of norepinephrine in the brain, improving concentration and impulse control. It was the first non-stimulant drug approved by the U.S. Food and Drug Administration for the treatment of ADHD, though the stimulants remain the support of ADHD therapy. Atomoxetine can lead to side effects like nausea, dry mouth, and insomnia. It's important to watch for signs of suicidal thoughts or behavior, particularly in children and adolescents. Using alcohol while taking atomoxetine may create toxic reactions in the body and should be avoided. Caffeine may also cause toxicity. Atenolol, a cardiovascular drug known as a beta blocker, used to treat high blood pressure and chest pain, angina, by blocking the effects of adrenaline on the heart and blood vessels, slowing heart rate and reducing blood pressure. The U.S. Food and Drug Administration, FDA, initially approved the drug in 1981. Atenolol may cause side effects such as fatigue, dizziness, and cold hands or feet. Precautions include avoiding sudden discontinuation of the medication, as it can worsen heart conditions. Atenolol can interact with other medications, such as calcium channel blockers and antidepressants, potentially causing additive effects on heart rate or blood pressure. Aspirin. Aspirin is a pain reliever and fever reducer used for various minor aches like headache, toothache, muscle pain, menstrual cramps, arthritis, and cold flu symptoms. It belongs to salicylates, quickly absorbed for long-lasting relief by blocking pain chemicals. It also reduces inflammation. Avoid giving aspirin to children with flu or chickenpox due to Reyes syndrome risk. Stick to recommended dosage to prevent stomach irritation. Take with food or water. Alcohol can worsen stomach issues. Aspirin can interact with medications like methotrexate and valproic acid and increase bleeding risk with blood thinners like warfarin and decumarol. Armodafinil, a medication used to treat excessive sleepiness associated with narcolepsy, obstructive sleep apnea, and shift work sleep disorder. It works by increasing the levels of dopamine in the brain, promoting wakefulness. Armodafinil may cause side effects such as headache, nausea, and anxiety. Precautions include avoiding use in patients with a history of heart problems or substance abuse. Armodafinil can interact with other medications, such as monoamine oxidase inhibitors and hormonal contraceptives, potentially reducing their effectiveness or increasing the risk of adverse effects. Aripiprazole, sold as Abilify, is a newer antipsychotic used for short-term treatment of acute psychotic and manic states, agitation and dementia, and long-term treatment of chronic psychotic disorders like schizophrenia. It works by modulating the activity of dopamine and serotonin receptors in the brain. Aripiprazole belongs to atypical antipsychotics, known for lower risk of certain side effects compared to traditional antipsychotics. Approved by the U.S. Food and Drug Administration in 2002, it's also used for bipolar disorder episodes after stabilization. Avoid alcohol while taking aripiprazole due to potential interactions with drugs like famotidine, valproate, lithium, dextromethorphan, warfarin, omeprazole, and lorazepam. Amoxicillin, a widely used penicillin antibiotic, treats bacterial infections like ear, lung, sinus, skin, and urinary tract infections. In the US, it's called Moxitag. It can also be used for stomach ulcers. Amoxicillin fights bacteria such as H. influenzae, E. coli, N. gonorrhea, and Streptococcus pneumoniae. Sometimes it's combined with clavulanic acid, sold as Augmentin, to boost effectiveness. Side effects may include diarrhea, nausea, and rash. Take with food to reduce stomach upset and complete the full course of treatment. Be cautious of interactions with other medications like oral contraceptives and warfarin, which can reduce effectiveness or increase bleeding risk. Amlodipine is a calcium channel blocker used to treat high blood pressure and chest pain, angina, by relaxing blood vessels and improving blood flow. You can find it in USA with the brand name Norvasc. Amlodipine besylate is one of a group of drugs known as long-acting dihydropyridine-type calcium channel blockers. Amlodipine may cause side effects such as swelling of the ankles, dizziness, and flushing. Precautions include regular blood pressure monitoring and avoiding sudden discontinuation of the medication to prevent rebound hypertension. Amlodipine can interact with other medications, such as beta blockers and certain antibiotics, potentially causing additive effects on blood pressure or heart rate. Amitriptyline, a tricyclic antidepressant, is prescribed for depression, neuropathic pain, and migraines by boosting serotonin and norepinephrine levels in the brain. It's also used for cancer-related pain and chronic pain. Typically taken at bedtime, it aids sleep. In the US, it's marketed as Elavil and Endep. Alcohol can enhance its sedative effects, while black tea may reduce its absorption. Patients should take the drug and tea at least 2 hours apart. Not for children under 12. Amitriptyline may lead to drowsiness, dry mouth, and blurred vision. Watch for worsening depression or suicidal thoughts, especially in young people. Avoid combining it with monoamine oxidase inhibitors or antipsychotics to prevent serotonin syndrome or increase sedation. Alprazolam, a tranquilizer, is U.S. Food and Drug Administration, approved for treating anxiety, panic disorder, and anxiety linked with depression. It's a benzodiazepine that induces less drowsiness than others, functioning by slowing brain activity to alleviate anxiety. While it can aid alcohol withdrawal, this isn't FDA approved. Side effects include drowsiness, dizziness, and memory problems. Avoid alcohol and grapefruit due to increased side effects. Be cautious of interactions with antidepressants and antifungal drugs, which can worsen side effects. Avoid driving or operating machinery while on alprazolam. In the U.S., it's marketed as Xanax. Almotriptan treats migraines by narrowing brain blood vessels and reducing migraine-triggering substances. It's a triptan medication, sold as Axert in the US and Canada, approved by the FDA in 2001 for adult migraine treatment. Side effects include dizziness, drowsiness, and chest tightness. Avoid if you have uncontrolled high blood pressure or heart disease. Interactions with selective serotonin reuptake inhibitors and monoamine oxidase inhibitors can cause serotonin syndrome.